we all, I think, can reach into our memory and reflect on a moment where we were very demonstrably treated like shit by the healthcare system. It is a routine occurrence for us.
Finding healthcare as a queer person can be terrifying. Sometimes it can feel impossible. The system is often ignorant to the LGBTQ+ community, and any queer competent healthcare providers can be hours away by drive or months away by appointment. That's why AG Breitenstein sought to make healthcare accessible. She's had firsthand experience with poor medical care and knew there had to be a better way. So she started FOLX Health, the first digital native health platform designed specifically for the queer community.
I'm AG Breitenstein. This is Pride.
Pride is a proud supporter of Outfest. Are you looking for a new show to binge watch? Me too. I've been asking friends and family for recommendations, but honestly, I'm stuck. But don't worry, Outfest has the perfect solution. They're launching The Outfronts, a 5-day virtual festival that aims to highlight all of the diverse characters from the LGBTQ+ community on TV today. So get some popcorn and get ready to add some new shows to your watch list. The event offers free panel discussions with talent from shows like VH1's RuPaul's Drag Race, Freeform's Everything's Gonna Be Okay, and so much more. And for just $5.99 a month, you can purchase an Outfronts membership and gain access to exclusive content like sneak preview episodes of some of your favorite shows. It's finally Pride Month, so this couldn't come at a better time. The virtual event will run from June 4th through June 8th on the Outfest Now streaming app. See stars from your favorite shows or discover something new to binge watch this summer. Go to theoutfronts.com for all things LGBTQ on TV. That's theoutfronts.com.
I am a 30-year veteran of healthcare and the CEO and founder of FOLX Health. I grew up in bedroom community in Connecticut.
As a kid, AG was a classic tomboy. She was tough and not afraid to get her hands dirty.
Usually scrapping around in the dirt, usually shooting bows and arrows and chasing dogs and running around in the woods as a feral animal for the most part.
But young AG was completely sheltered from the LGBTQ+ community. None of her peers were gay, at least not openly, and nobody in her neighborhood talked about queer people. As far as she was concerned, they didn't exist.
Went to a high school where there was not a single out person, including myself. I was completely, unself-aware in so many ways, but also knew that, as I think so many of us do, I can't stay here because one of these things is not like the other, but I'm not exactly certain what that is.
She got her first taste of queer culture when she watched the 1983 horror film The Hunger with Susan Sarandon and Catherine Deneuve.
What have you done to me?
It's natural. You don't know what's happening to you, but there's nothing to be frightened of. As long as you put your faith in me, give me time, trust me.
I saw that movie and I was like, oh, wow, okay.
For anyone who isn't familiar with the film, Deneuve plays a vampire who gets caught in a love triangle between her former vampire lover, David Bowie, and her new love interest, Sarah, played by Susan Sarandon.
I've given you something you never dared dream of.
What?
Everlasting life.
I remember being completely freaked out and completely didn't know where to go to be able to get closer to that.
But her freedom to explore her sexuality didn't come until after she left home.
It wasn't really until college that I was like, okay, there's other people around like me and maybe I can go off and explore this.
While AG was going through a journey of her own, the HIV AIDS epidemic had just started making headlines. By the end of 1984, there had been well over 7,000 AIDS cases and over 3,000 AIDS deaths in the United States alone. But instead of focusing on the fatal impact the disease was having on queer lives, the coverage of the pandemic was extremely homophobic.
There was just a lot of fear and a lot of just unbelievable stigma.
But on top of all of that, there was a sense of community.
When I got out of school and had moved to Boston, there was a real sense of people taking care of each other across the spectrum of the queer and trans community, and a real sense that nobody else was going to do it for us. So we really had to cross lines that, a lot of hadn't been crossed. Lesbians and gay men didn't interact all that much. The trans community, wasn't included in the way that we think of it today. But there was a real sense that if we didn't take care of each other, it was going to be a hell of a lot worse than it was.
When a queer person comes out to their friends and family, there's always a fear that they won't be accepted. But for young LGBTQ+ individuals, not being accepted can mean losing their family and even their home. Forced to live on their own, many end up experiencing homelessness, and they're more vulnerable to diseases like HIV.
This community was, at far higher risk for HIV because a lot of folks just had no support system to go to. They would essentially lose family, friends, the entire infrastructure of their lives in that vulnerable of a situation. The cops were just doing sweeps of the streets on just a continuous basis and harassing people and giving them no quarter. And then the shelters wouldn't let them in. I mean, it was just, so everybody was getting swept up.
When AG saw this happening in Boston, she knew she had to help her community. So she teamed up with others who were passionate and motivated to make a change.
For food and for housing and for medical care. And the piece that I was putting in was legal support for folks because, everybody was legally involved.
And these kids on the streets, they're not all there because they made a bad decision. It usually has to do with them being queer, and that's it.
A young lesbian whose parent was actually on the city council at the time, and this kid was an honor student, and you couldn't tell a story that wasn't like, this kid just checked every box that a parent could possibly put up for their kid. And parent was, in quotes, pillar of the community. And this young person just, their whole family situation imploded all in a single night. And then they were suddenly homeless. And that, that to me was always like, very poignant because this was the kid that did everything to be the good kid.
AG says it all comes down to a single moment in these kids' lives.
Where they came out or something was discovered and their lives just changed sort of instantaneously. That was always the shared experience. And across, like I said, every denomination of life experience and race and ethnicity and income, all of it came back to this moment when, the ideal of who you are in your parents' eyes suddenly shifts so dramatically and they couldn't process it. And then there'd be a catalytic event. And then kids would suddenly find themselves in the streets. But it was, it would, every time it took my breath away, like it still does to this day, take my breath away.
LGBTQ+ homelessness has been an issue for a long time, but people haven't always cared. AG says there has been an increase in awareness over the years, but not enough action. In a 2020 report, more than half of homeless individuals found in Arizona, Arkansas, California, Nevada, and Oregon were unsheltered.
We had a few allies at the Department of Public Health and a few allies at the Department of Social Services. We had no allies in any of the law enforcement or judicial system. The judges didn't give a crap. I think there's more awareness. I think there's more sort of general understanding that this is an issue, but I don't see the tide changing all that much.
LGBTQ youth aren't always kicked out of their homes for being queer. Sometimes their parents implement strict rules in an attempt to stop their kid from being queer.
Situations where their parents are like, not under my roof will you do fill in the blank. You are not starting hormones. You are not going to do that. Long list of, be what you are, but don't be that in front of me.
But when they can't be themselves in their own home, they decide to leave. This scenario in particular can be very harmful to the transgender community.
When I was working in this area, the resources were almost nothing. And today, there is, I think, a better understanding on the healthcare side of, what we can do for younger sub-18 trans youth and what that looks like if you have a supportive family, which most people, I would say, probably don't. Or even if they do, they probably don't have folks that have access to information and resources. And if you're lucky enough to live usually in a city with like a large academic medical center and really progressive resources, generally, you may find a small cadre of clinical professionals who are willing to support the family and willing to support the young person in terms of what proper care in this situation looks like.
Very few people have these kinds of resources at their discretion. More often than not, individuals are forced to deal with uninformed pediatricians and categorical ignorance
about, what the treatment looks like for youth as opposed to folks that are considered legal adults, whatever that means. So the profile today is better, but access to it is still really, really inequitable in terms of what people can get depending on where they live in the country.
Thanks for watching part 1 of our interview with A.G. Breitenstein. In part 2, we'll talk about queer health and medicine and how A.G. Breitenstein's company, FOLX Health, is changing it all.
Straw Hut Media.